For decades, the medical edict was crystalline and absolute. Salt was poison for the heart. This simple white crystal, a staple of pantries and dinner tables for millennia, was recast in the 20th century as a primary public health adversary. The consensus was built upon a seemingly straightforward physiological chain. Sodium intake increased blood volume, which elevated pressure within the arterial walls. High blood pressure, or hypertension, was a silent killer, a major risk factor for devastating strokes and heart attacks. The logical conclusion was universal and rigid. To protect the heart, one must restrict salt. This advice transcended medical journals and entered the cultural bloodstream. Doctors delivered it with unwavering authority to every patient, regardless of age or individual health profile. Public health campaigns echoed the directive, their messaging stark and memorable. Food packaging began to trumpet low sodium as a virtue. The dinner table became a minefield of hidden sodium, with processed soups, canned vegetables, and even bread implicated as treacherous sources. The goal was a drastic reduction, a stripping away of this pervasive mineral from the modern diet. The narrative was powerful in its simplicity. It offered a clear villain and a clear solution, a rare certainty in the complex world of human health. Patients were instructed to banish the salt shaker, scrutinize nutrition labels, and embrace blandness as a form of righteousness. This directive became ingrained, an unquestioned pillar of preventive care. Generations grew up believing that any amount of salt beyond a bare minimum was inherently dangerous, a direct threat to cardiovascular longevity. The authority of this recommendation was nearly total, setting the stage for a quiet, observational revolution that would question the very foundations of this long-held truth. In the hushed corridors of geriatric clinics and on the quiet floors of long-term care facilities, a different story began to unfold. It was not announced with fanfare, but observed in a series of subtle, troubling patterns. Doctors and nurses, the frontline observers of human physiology under stress, started to notice a constellation of problems in their older patients who were diligently following the low-salt creed. The villain, it seemed, had an unexpected victim. The issues were often dismissed as mere signs of aging, but their correlation with strict dietary sodium restriction became impossible to ignore. There was the persistent dizziness upon standing, a lightheadedness that turned simple movements into perilous undertakings. A profound, unexplained fatigue settled over patients, sapping vitality not from disease but from diet. This fatigue, coupled with poor balance and orthostatic hypotension, a sudden drop in blood pressure when rising, led to an increase in falls, those catastrophic events that can shatter an elder's independence in an instant. More alarming were the episodes of confusion and mental fog, where patients who were normally lucid became disoriented and slow, their cognitive function dimmed. In severe cases, these symptoms culminated in a diagnosis of hyponatremia, a dangerously low level of sodium in the blood, a condition that could induce seizures, coma, and even death. This clinical picture forced a fundamental reconsideration. The medical community began to grapple with the critical concept of salt sensitivity. For some individuals, particularly those with certain genetic predispositions or existing hypertension, reducing sodium intake did indeed lower blood pressure. They were salt sensitive, but for a significant portion of the population, especially many older adults, sodium intake had a minimal effect on their blood pressure. They were non-sensitive. The universal prescription had failed to account for this biological variance, and the non-sensitive elderly were paying the price for a one-size-fits-all approach. The reasons are rooted in the profound physiological shifts of aging. The kidneys, the body's masterful filtration and balance organs, gradually lose some of their functional capacity. Their ability to conserve sodium efficiently when supplies are low diminishes, making older adults more prone to wasting this essential electrolyte. Concurrently, the body's hormonal landscape changes. Levels of renin and aldosterone, hormones crucial for signaling the kidneys to retain sodium and maintain blood volume, often become blunted with age. Perhaps most critically, the thirst mechanism becomes unreliable. The sharp, compelling signal to drink water fades, leading to a chronic state of mild dehydration. In this context, sodium becomes not a villain, but a guardian. Sodium's primary role is to regulate fluid balance. It holds water in the bloodstream, maintaining the crucial volume needed for the heart to pump effectively. For an older person with declining kidney function, muted hormonal signals, and poor thirst drive, adequate sodium is essential to preserve this blood volume. Without it, pressure drops precipitously. The heart struggles to deliver oxygen and nutrients to the brain, leading to dizziness and fatigue. The brain itself, bathed in a diluted, sodium-poor fluid, can swell slightly within the rigid confines of the skull, causing confusion and cognitive impairment. The low-salt diet, intended as a shield against vascular disease, had become a catalyst for a different kind of crisis, a crisis of stability, clarity, and physical safety. The rigid advice of the past was creating a cascade of unseen consequences, revealing that in the intricate system of an aging body, balance is far more critical than blanket restriction. The emerging understanding of sodium's dual nature has dismantled the old, rigid paradigm, replacing it with a modern, nuanced equation for cardiovascular health. Today, the focus has shifted decisively from demonizing a single mineral to evaluating the entire dietary and lifestyle landscape. Salt is no longer the sole variable. It is one factor in a complex algorithm where overall diet quality, potassium intake, hydration status, medication interactions, and individual blood pressure patterns are all critically weighted. The contemporary medical approach begins with context. A doctor now considers the source of a patient's sodium. Is it from a sprinkle of sea salt on home-cooked vegetables, or is it from ultra-processed meals, fast food, and packaged snacks? This distinction is paramount. The dangers are increasingly linked not to salt itself, but to the nutritional wasteland that often accompanies it. Foods laden with refined sugars, unhealthy fats, and chemical additives, while devoid of fiber, antioxidants, and essential nutrients. These foods drive inflammation, insulin resistance, and obesity, which are potent drivers of hypertension and heart disease far beyond the effect of sodium alone. Potassium has risen to co-star status in this new equation. This mineral acts as a physiological counterbalance to sodium, helping to relax blood vessel walls and promote the excretion of excess sodium through urine. A diet rich in fruits, vegetables, beans, and dairy, naturally high in potassium and low in processed sodium, is now seen as a more powerful protective strategy than sodium restriction alone. Hydration is scrutinized with equal importance, especially for older adults, as adequate fluid intake is essential for maintaining blood volume and allowing the kidneys to function optimally, whether conserving or excreting sodium. Individualization is the cornerstone. Physicians assess a patient's unique blood pressure patterns, including orthostatic drops, and review medications like diuretics that can deplete sodium. They consider kidney function and overall vitality. The core takeaway is one of empowered balance. Health advice evolves because science evolves, and our bodies change across a lifetime. What protects a middle-aged person with hypertension may harm a vibrant 80-year-old. The lesson is not to distrust medical guidance, but to embrace its necessary complexity. Informed, individualized decisions, made in partnership with a healthcare provider, have permanently supplanted the era of rigid, universal rules. The goal is no longer mere restriction, but harmonious balance, a symphony of nutrients working in concert to sustain the intricate rhythm of a life in motion.